First heart sound is S1 and second heart sound is S2. Gap between S1 and S2 is known as systole, and gap between S2 and S1 is known as diastole. In between S1 and S2 there is ejection click just after isovolumetric contraction, and in between S2 and S1 there is opening snap just after isovolumetric relaxation. S3 seen in rapid ventricular filling and S4 seen in atrial systole. S1 is due to closure of mitral and tricuspid valve. S2 is due to closure of aortic and pulmonary valve. Ejection click occurs due to opening of aortic and pulmonary valve. Opening snaps as result of opening of mitral and tricuspid valve. S3 is due to rapid filling. S4 is due to atrial systole. Auscultatory area. Mitral areas is a fifth intercostal space on left side just medial to mid-clavicular line. Aortic area is second intercostal space on right side. Pulmonic area is on second intercostal space left sternal border. Tricuspid area is on fourth intercostal space left sternal border. Erb's point is a third intercostal space left sternal border. Remember, S3 and S4 are low-frequency sound which can be heard by bell of stethoscope. Mid-diastolic murmur of mitral stenosis is a low-frequency murmur which is best heard by using bell and on left lateral decubitus position. First heart sound. First heart sound is S1 which is heard due to closure of mitral and tricuspid valve. It produces lub sound. Better heard at mitral and tricuspid area. Abnormalities of S1. First is loud S1. Loud S1 is seen in condition causing tachycardia, or short PR interval, means PR less than 120 milliseconds, which includes thyrotoxicosis, pheochromocytoma, CHF, severe anemia. Other causes include mitral stenosis, tricuspid stenosis. Physiological loud S1 heard in pregnancy, children. Soft S1 is heard in bradycardia, or long PR interval, means PR interval more than 200 milliseconds, which includes heart block, hypothyroidism. Other causes includes obesity, emphysema, pericardial effusion, mitral and tricuspid regurgitation, calcified severe mitral and tricuspid stenosis. Second heart sound. Second heart sound is known as S2, which occurs due to closure of aortic and pulmonary valve. It produces dup sound, which is best appreciated in aortic and pulmonary area. Splitting of S2, normally aortic valve closes first then pulmonic. Gap between closure of aortic and pulmonary valve is 30 milliseconds. Effective respiration on S2, usually pulmonary valve is affected by respiration. During inspiration, pulmonary valve closure is delayed, and during expiration it closes early. Abnormalities of S2. First is narrow split S2, which means gap between AV and PV is less than 30 milliseconds. Causes: aortic stenosis, hypertrophic cardiomyopathy, patent ductus arteriosus, left bundle branch block, Wolff-Parkinson-Wolff type B. Wide split S2, gap between AV and PV is more than 30 milliseconds. Fixed wide S2 is a feature of atrial septal defect, and variable wide S2 is seen in ventricular septal defect, mitral regurgitation, right bundle branch block, Wolff-Parkinson-Wolff type A.